What if I told you that your cholesterol could be high not because of what you eat and not because of your genetics, but because of how you sleep and how stressed you are? I have seen patients who eat healthy, exercise daily, but still come back with LDL cholesterol that refuses to budge. And when you dig deeper, you realize that the common thread is stress and poor sleep. These hidden factors can drive your LDL up and make your arteries inflamed and increase your risk for heart disease and stroke, even if your diet looks perfect. Today, I'm going to show you how stress and sleep directly influence your cholesterol, especially LDL. We will break down the science into simpler terms, and I will share real patient examples. And most importantly, I will give you practical strategies to fix it. By the end of this video, you will know how to protect your heart, not just with food and exercise, but by mastering sleep and stress. Let's start with a quick refresher on LDL. LDL stands for low density lipoprotein. Think of it as a delivery truck carrying cholesterol to different tissues. Here's the thing, it's not just how much cholesterol the trucks are carrying. What really matters is how many trucks or particles are on the road. That's what ApoB measures. More trucks means more chances to bump into the arterial wall and cause damage. LDL is not evil. Your body needs cholesterol. But too much LDL over time, especially when combined with stress and inflammation, raises your long-term risk for heart attack and stroke. So, why do stress and sleep play such a big role? Let's break it down. So when you are stressed, your body releases cortisol and adrenaline. These hormones prepare you for flight-fight mode. They raise your blood pressure, your blood sugar, and yes, cholesterol. Here's how. Cortisol tells your liver to pump out more VLDL, a fat-carrying particle. This VLDL eventually turns into LDL. So chronic stress, meaning your liver is overproducing VLDL, that means your LDL is staying high. Stress also lowers your HDL, which is a good cholesterol, and raises triglyceride. On top of that, stress creates inflammation into your arteries, making them more likely to collect cholesterol deposits. I had a patient, a 45-year-old executive. He ran marathons, ate clean, didn't drink much, but his ApoB is through the roof. The only risk factor is high-stress job. He travels non-stop, slept 5 hours a night, and glued to emails 24/7. Once he learned stress management techniques like mindfulness and exercise for relaxation, not for competition, and setting boundaries, his ApoB dropped down significantly, 25 points in 6 months. The science is clear. Workplace stress, caregiver stress, financial stress, all of it correlates with higher LDL and ApoB. Now, let's talk about sleep. Sleep is not an optional downtime. It's actually an active recovery for your brain, your heart, and your metabolism. So when you don't sleep enough, your cortisol stays elevated. Your body becomes more insulin resistant. Your sympathetic nervous system, that fight-flight mode, stays switched on. All of this raises your LDL and lowers your HDL and increases inflammation. People who are constantly sleeping less than 6 hours a night have 20 to 30% risk of high cholesterol. Sleep apnea makes it worse. The oxygen dips triggers oxidative stress, leading to damaged LDL particles that stick to arteries more aggressively. I once treated a truck driver with high cholesterol. He wasn't overweight, he didn't smoke, but he had untreated sleep apnea. His oxidized LDL levels were very high. After starting CPAP, not only did he feel more rested, but his cholesterol profile improved. If you work night shifts, your circadian rhythm gets disrupted. The way your body processes fat at 2 a.m. is different than 2 p.m. Night workers have constantly higher rates of metabolic syndrome, including high cholesterol. So bottom line is, poor sleep is like gasoline on the cholesterol fire. Now, imagine stress and poor sleep combined together. Stress keeps cortisol high and lack of sleep prevents it from coming down. This vicious cycle makes cholesterol harder to control, even if you are dieting and exercising. That's why some people hit a wall. They eat perfectly, but don't see results. If you don't address stress and sleep, your LDL may stay stubbornly high. So, how do you track this? Start with basic lipid panel, LDL, HDL, triglyceride, but don't stop there. Ask for ApoB. This is the best measure of particle count, the actual risk factor. If you can, check oxidized LDL. This tells you how much of your cholesterol is damaged by stress and inflammation. And you can also add high sensitivity C-reactive protein to measure inflammation. And in some cases, check fasting insulin or morning cortisol levels. This will give you an insight into the stress metabolism connection. These numbers change when stress and sleep improve. And that's empowering because you can measure your progress, not just hoping for it. So, what can you do? For stress, daily meditation or mindfulness, even 5 minutes. Breathing techniques to activate your parasympathetic system. Journaling or practice gratitude. And talking to a therapist or a coach. Exercise is very good as a stress relief, not punishment. And for sleep, go to bed and wake up at the same time. Make your room cool, dark, and quiet. Avoid caffeine after 2 p.m. And turn off screens an hour before bed. And if you snore or you feel exhausted, get tested for sleep apnea. And for both stress and sleep, try to practice this evening wind down routine. Limit alcohol because alcohol can disrupt sleep cycles, and use exercise strategically. Cardio lowers stress, resistant training improves insulin sensitivity, and both help lower cholesterol indirectly. Nutrition plays a role too. Omega-3, fiber, and polyphenol from plants can help balance LDL. But remember, without stress and sleep under control, diet only gets you halfway there. Here is a big takeaway. Cholesterol management is not just about food and exercise. Stress and sleep are hidden, powerful drivers of LDL, ApoB, and overall heart risk. I have seen patients cut their LDL by 20 to 30% simply by improving sleep and lowering stress with no major diet changes. That's how powerful this connection is. So next time you check your cholesterol, ask yourself how I am sleeping and how stressful I am. Because the truth is, managing stress and sleep is managing cholesterol. If you find this video helpful, please like and subscribe and share it with someone who struggles with cholesterol. And tell me in the comments below, have you noticed your labs change during periods of stress and lack of sleep? I would love to hear your experience. Thank you so much for watching, and I will see you in the next video. Thank you. Bye bye.